This PowerPoint is to talk about the culturally competent nursing care of the Hispanic family. Nursing care across the lifespan of the Hispanic population. My name is Elizabeth Barnicastle. Culturally competent nursing care is required when caring for the Hispanic family across the lifespan. Poor health outcomes in Hispanic populations can be attributed to language and cultural barriers, as well as lack of health insurance and access to preventative health care. Hispanics have cultural attributes that may influence or conflict with traditional Western health care views. The first attribute is familismo, which means family. The family unit consists of the parents, children, and extended family. Decisions are not made by the individuals without consulting the family first. That leads to important medical decisions being delayed until they consult with the family members, and often that is the oldest male in charge. The Hispanic population follows a generational hierarchy. The second attribute is respeto, which means respect. They place high value on respect when interacting with others. Each person defers to those in a position of authority, such as somebody older than them, the male, gender, social position, economic status, and title, such as the doctor has a title. Healthcare providers are figures of authority, so the Hispanic patient may be hesitant to ask questions or raise concerns. But Fatilimoso is a strong belief that uncertainty is inherent in life and each day is taken as it comes. It's the belief that the individual can do little to alter fate, and they are less likely to seek preventative screenings, may delay seeking medical care until symptoms become severe, and the Hispanic patient may also avoid therapies for cancer and other chronic diseases, especially new treatments and invasive procedures. The last cultural attribute is simpatico and personalismo. Simpatico means kindness and refers to an emphasis on politeness and pleasantness, even in the face of stress. Basically, it means being kind with people. Latinos or Hispanics may read the neutral or business-like effect of Western doctors as negative. This reduces the likelihood of compliance with the doctor's recommendations for treatment and follow-up. Culturally competent care in the childbearing woman. Some facts include that 25% of the Hispanic population in the U.S. are women of childbearing years. Hispanic women have the highest birth rate in the U.S. Concerns: limited access to health information regarding pregnancy and child rearing. And another big concern is postpartum depression. They do not self-report because of feelings of shame and guilt, because family is very important to this culture, and to have postpartum depression, which also comes with feelings of negativity toward the baby, would be very, very shameful. Inconsistent screening and diagnosis among the population. That is because a lot of times the woman does not come back for the 6-week postpartum checkup. Recommendations: increase the number of Spanish-speaking nurses, include family and education of postpartum depression, social networks such as support group, meetup groups, screen for depression during pregnancy instead of waiting till the postpartum checkup, and implement the universal screening tool in Spanish during childbearing years. Children birth to 17 years old. Chronic malnutrition in the presence of obesity. Poor quality diets of high-calorie foods is the main reason for obesity in Hispanic children, and also in malnutrition. There is an issue with chronic malnutrition because the diet is poor quality and high calorie. It also lacks micronutrients. So there is stunting or height deficit. Recommendations are to treat the individual, involve the entire family on importance of well-balanced diet and exercise, and a dietitian consult. The adult population. Mexican Americans suffer from a high burden of chronic disease. The Hispanic population from Mexico has surpassed African Americans as the largest minority population in the U.S. 79% of Mexican American adults are overweight or obese. Cardiovascular disease, the leading cause of death among Hispanics, also affects mental health. Strategies used by uninsured Hispanics regarding health care include delaying care or ignoring treatment, sharing medication, using false identification to visit emergency rooms. The poverty rate for Hispanics aged 65 and older is twice that of others in the same group. The ability to acculturate may play a large part in the lack of adherence to recommended health care measures. Some concerns of the older adult. They're twice as likely as non-Hispanic whites to be diagnosed with diabetes. Cardiovascular disease is the leading cause of deaths in Hispanic adults. Hispanic adults age 65 and older also are vaccinated at a much lower rate against the flu and pneumonia. The Hispanic communities in general are more likely to delay needed care, have chronic conditions that go undiagnosed or are diagnosed at later stages, and have negative outcomes related to chronic conditions and being unsatisfied with their providers. Hispanics are less likely than any other racial or ethnic group to have health insurance, attend regular medical checkups, have a usual source of care, or be regularly screened for several forms of cancer or other chronic conditions. In summary, Hispanic families face numerous social, economic, and structural barriers to health care. As a group, they have low income, high poverty rates, and poor educational opportunities, factors consistently found to affect health and health care. Culturally competent nursing care across the lifespan assures this population is receiving necessary medical care in the appropriate time, but within an environment that offers respect to their personal and cultural beliefs and values.